Hello, everybody. I'm Bob, and I'm here at Dr. Hubner's office. I came from very far away to come to just to go to this guy because he's the guy that creates very creative. He actually does miracles. I don't know how he does it, but I've seen people that he's done, and I can tell you that when you walk out of here and you start seeing your hair grow, nobody will ever say to you, "Did you do a transplant?" So if you really want somebody good, this is the guy to go to. But I'm not going to give you phone numbers or anything. I'm sure they'll do that afterwards. But I can tell you that this is the place to be. This is the place where I'm going to be very happy in a few hours, and then in a few months I'm going to be delirious. So come, make the call, because you want the best, and there's nothing better than the best.
When did you start losing your hair?
About 35 years ago. I pretty much in my late 20s, early 30s, I started losing my hair, and went rather quickly. Once it started to go, it was a race to the finish. And after several years of after it getting thin, what I did was I went to this place to get I wasn't ready to do a transplant at the time, so I went and got a hairpiece, and I was wearing the hairpiece until now, actually. So I can't wait to take the hairpiece off and get going. I actually did several. You can probably see it here. I did several different transplants in the past, probably about 20 years ago. And back then, the technology isn't what it is today. And you can see the cornrows growing out of my head. And obviously, that's not the way you want your hair to look. It doesn't look natural. I saw some of the guys that Dr. Hubner did. I mean, honestly, it's hard to believe that this can be recreated. And so he has really a challenge with me because he has to fix the crap that's on my head and recreate everything from new, and then strategically move things around. So I'm looking forward to it. I have complete confidence in this man, and his reputation precedes him. He's a great doctor and a good person and a regular human being.
Dr. Hubner here. I'm here with Bob, and we're about to start a surgery, but I just wanted to show you how we've drawn out his hairline. So in Bob's case, his old hairline was a little asymmetric, so we brought this side down on the left a little bit further to make it more symmetric. But more importantly, you can see the old style plugs. So this is stuff that was done 20 years ago. So in 1996, he had some surgery where he had plugs. And what we're trying to do now is soften everything up and basically hide this plugginess. So we fixed all these old school transplants all the time. And what they did to get those plugs, I'm going to turn them around. Good thing you can't see it from the back, but what you can see, if you really get in there, is you can see all these circular scars from where they got the plugs. And it might show up a little bit better once I straighten the area we're going to take, but you can see that there's going to be scar tissue in our strip today. There's no way of getting around that. There's no way of getting around that. So, but today we're going to get him as much hair as we possibly can. We're going to work our way from the front, start from the front, and work our way all the way back until we run out of hair. I'm very excited about today. This is going to really change his look, and we're going to soften up all this plugginess and old school transplant style that he had 20 years ago. So, looking forward to your progress, Bob. We'll check in with Bob in a little bit. Dr. Hubner here again. I just wanted to show Bob's basically his scars from his old school transplants that he had. So these are little circular scars. Now it's interesting because there's a technique today called FUE, which uses the same type of technique but a much smaller radius for these scars. So these little tiny scars, it kind of looks like Swiss cheese in the back here. Now the ones for FUE aren't quite as big, but you can appreciate that there's a lot of scar tissue through here. And each one of those scars has no hair. So the amount of hair we're going to get today is a little bit less than we would get if he didn't have those transplants. But unfortunately what they did is they used the entire width of his donor area, similar to say FUE that they do today, So you can see that that would really, you know, what it looks like. So in any case, we're still going to go for it today. We're going to get him as much hair as we can, and looking forward to really showing you what we can do for these guys that have had transplants in the past. Okay, I'm here with Bob, and at this point in the procedure, we're about 1/3 of the way through, which means we've done the anesthesia all the way around, we've taken out the strip, and we've sewed him up. So now we're giving him a chance to stretch his legs, and he's drinking some coffee. How's the day been going for you, Bob?
I'm telling you, it's been a lot easier than I thought it would be. There's really no pain at all. A little bit of little needle pricks, but I mean, you don't even feel it.
Yeah.
And the whole thing went so quickly. Now we're kind of halfway through, and now we're going to go up and do the. I'm telling you, man, I'm so pleased with the way everything is going, and the amount of hair that they were able to. What's the word? Harvest?
Yes. To basically take from the donor in the back. Yeah. You can see again his hairline where it's going to be. So we haven't done any of the sites yet on the front. You can see a little bit of bruising underneath the hairline. That line is just a little bruising that'll clear up in a couple days. That's just from the anesthesia. And I'm going to go from the back here, and you can see that everything is completely hidden. His limiting factor is going to be those pencil eraser scars, not my scar. So, but everything's completely hidden. And you can see we're going to try to get back to this line today. You can see how those plugs, those old style plugs, look like doll's hair. See in the back here? So this is all the way they used to do it 20 years ago. So probably not going to get all the way back there today. We want to focus on his hairline. We want to soften everything up and get back as far as we can. So anyway, Bob, thanks for letting us check it on you, and we'll see you in a little bit.
Thank you. And if you've had a transplant before, it doesn't matter if it's 10 or 20 years ago or 2 years ago. You have to find somebody that's creative and knows how to work around them and knows how to harvest the most hair because of all that crap that's back there. So this FUE or FUC or F whatever, that FU whatever,
FUE.
That's a crock, because you're still going to get those little marks back there the same way that I had it 20 years ago, only they're going to be a little smaller. So you want to do something that doesn't show anything back there. There's hardly a tiny little line. It's perfect.
Right.
And you're in good hands.
He's exactly right. And you're not ruining anything for another procedure if you need one, because you don't have those polka dots all the way up and down on your donor area. So you can go right above or below that line and get fresh, unscarred tissue, which is nice. So anyway, Bob, thank you again, and we'll talk to you soon.
Thank you.
Okay, I'm here with Bob, and Bob has just completed his surgery. Bob, how do you feel? How was the surgery? How was your overall experience today?
I have no words. I mean, it's absolutely stupendous. It's a great experience, and I have a feeling that the results are going to be spectacular. Very little pain, very little discomfort, and the staff. I got to tell you about the staff. Are you listening to me? You got it. The staff is unbelievable. They treat every little thing, anything you say, they're right on top of it. Everything they do is perfect. They're very conscientious about the fact that that I'm on that chair and all those things are happening to me, and they know how I feel. They anticipate what I'm going to do and what I'm going to say, and they're right in front of it. And I can't say enough of Dr. Hubner and the whole staff here. So I look forward to coming back on this video and showing you the results, which I think are going to be spectacular. And until then, call Dr. Hubner.
Thank you very much, Bob. We'll talk to you very soon. Thank you.